I'm Cynda Rushton, the Bunting Professor of Clinical Ethics in the Berman Institute of Bioethics and School of Nursing here at Johns Hopkins University. And I want to welcome you to part one of this three-part series on preserving integrity in turbulent times. So today, I want to give you a little bit of my background so you'll understand where I'm coming from. I am a nurse for many decades now. And I have spent a lot of my career, starting first in the intensive care unit in pediatrics, and throughout that time, beginning to think about the ethical issues that arise in clinical practice. And so the perspective I'm going to be sharing with you is very much informed by my role as a nurse in many, many complex healthcare systems. I have, since 1999, been the co-chair of the Johns Hopkins Hospital Ethics Committee and Consultation Service, and have done hundreds of clinical ethics consultations involving patients, families, and clinicians. And through that work, have begun to explore the dimensions of moral suffering that clinicians experience in their roles as they try to navigate the ethical territory that is inherent in our work. So with that as a background, I just want to offer this content with the idea that while these concepts are probably universal, what has informed my understanding of them is primarily through my own clinical practice and in my role as a nurse. So what I'd like to do today is to spend some time talking about these issues of moral adversity. And I am going to pause here to be able to share with you some slides that will inform the way that we discuss these issues together. So as we talk about this issue of preserving integrity in turbulent times, I wanted to first begin with a little bit of an orientation toward the domain that I want to speak about today. And I want to talk about the ethical and moral domain in a very broad way. It's certainly been defined in many different ways, but mostly it's concerned with our behavior, the choices that we make, our intentions, and our character. It concerns, understandably, norms and standards that guide our behavior or conduct. And in this domain, we often search for reasons for the actions or decisions that we make. And certainly those norms and standards influence our responsibility to respond to these inevitable ethical issues that arise. Sometimes it's easy to think about ethics as just a set of precepts or prescriptions. But I'd like to propose that this ethical and moral domain is not a set of rules, it's actually a practice. It requires our ongoing attention and insight and inquiry to determine how we might use these tools of moral reasoning to answer some of the hard questions. I'd like to even go further to suggest that this ethical orientation, our moral and ethical orientation, is embedded in moment-to-moment awareness and action. What I mean by that is often it's easy to think about ethics as the thing you do afterwards, or it's the thing that is a separate kind of activity. But in many ways, all of our decisions, our values are part of everything that we do. And so I would argue that this moral and ethical orientation is actually embodied, it's lived, it's beyond talking about our values to actually living them in our day-to-day lives. And because of this, it engages a kind of somatic awareness. And if you think about how you detect when there's something of value, or when you may be having a situation that involves important ethical values, our bodies often are great reservoirs of information to help us locate what is of value, and potentially where there may be ethical tensions or conflicts. So just to think about how your body informs your thinking. You know, we think everything happens in the little black box in our skulls, but actually the awareness from a neuroscientific point of view starts way before our conscious awareness. These moral and ethical values and our orientation is also very inherently relational. It's one thing to know what I believe and what values I stand for, but in reality, we are constantly negotiating those in relationships. And we're going to come back to this issue of relationship a little bit later in this series. And to a large extent, the decisions that we make, how we are in the moment, are a reflection of our character. And so this rather broad definition of this domain of moral and ethical practice is the foundation on which I want to build in this series. When we think about this orientation, this domain, there are a lot of ethical values that come to mind, things like dignity, the inherent worth of every person, respect as a way that we honor the dignity of other people. We often intend to do good, to benefit either others or ourselves as we try to do the right thing when there are conflicts among these values. And justice is a very important and prominent value for many of us. The issue of how do we conduct ourselves and make decisions, how do we engage in understanding what justice requires of us, the idea of fairness and non-discrimination, and how we honor diversity and include everyone in either our own individual decisions or those that we have relationships with, but also more broadly in terms of our communities and our country. Honesty and truth-telling. How we relate to truth is a very important way that we understand the world and how we understand our obligations. Compassion is another ethical value that's present in many, many traditions. Different ways of looking at ethical questions is compassion, that ability to actually perceive the suffering of others and to be motivated to action, to do something about their circumstance, to hopefully relieve their suffering in some way. Integrity, that sense of wholeness and that sense of being in alignment with our values. And another one is non-harming, or actually preventing harm. And as a healthcare professional, that is a very important value, that we first do no harm to others. There are other ethical values that you might have an affinity for, but these are just some of the ones that may reasonably come up as you're thinking about the kinds of conflicts that arise in our world today. So just to pause for a second, there's no one on the planet who is unaware of the complexity and the chaos and the confusion that we have all been involved in, especially during these last 5 or 6 weeks related to the COVID-19 virus. It's very easy to feel distracted away from what really matters, or in the opposite, it might be that this crisis has helped us to remember what really matters and to prioritize our values in a different way. But often there's a lot of uncertainty, and there may be conflicts in our values about how do we actually respond to the myriad questions that are confronting us on a daily basis. So we may feel this sense of chaos, and for many people, a sense of dysregulation that I really don't know what my moral compass is or where to even start to either name or to respond to these kinds of questions. So the idea of moral adversity is a concept that really grounds this work in moral resilience. And we've defined it as the situation that occurs when internal and external circumstances or actions produce morally objectionable, troublesome, or unfortunate results that can imperil our integrity and our well-being. And this adversity can affect us either individually or collectively. And it might occur really across the spectrum. For some kinds of situations, it may be quite mild, where we feel a sort of sense of unease or anxiety about how to respond, for example, to whether or not we ought to wear a mask when we go out in public. It may also include situations where we feel like our moral compass, those important core values that we hold, have been either threatened or violated in some way. And it may also include instances where we've actually participated in moral wrongdoing or have brought about harmful outcomes for ourselves and others. And I think we can safely say that there are a whole continuum of ways that moral adversity shows up, both in our personal and our professional lives. So I'd like to invite you at this point to just pause for a moment and to reflect. If you think about your own experience over the last, say 2 or 3 weeks, what are the ethical issues that keep you up at night? What are the things that at the end of the day still are sort of nagging at you? Maybe they are situations that have ignited your conscience in some way, or your sense of threat to some values that you have. So I'd like to invite you just to take a moment and pause now and jot down just a few ideas. What are the things that keep you up at night? Just jot down 1 or 2 ideas. And just notice as you do that, what comes up for you, what sort of sensations you feel in your bodies, how's your heart, your emotions, what your mind does as you try to recall things that keep you up at night. So with that in mind, I want to offer a sort of broad umbrella for the next piece of our exploration today, and that is moral suffering. And this work on moral suffering really came out of my own experience as a pediatric critical care nurse and then later as a clinical nurse specialist. Recognizing that in the context of my role, there were situations that really left me feeling diminished in some way. And I had the opportunity to do some important work with Warren Reich, who was a theologian at Georgetown at the time. And his work on suffering really resonated for me. So we define moral suffering as the anguish experienced in response to moral harms, wrongs, or failures, all those different types of moral adversity, and unrelieved moral stress. And what's important about moral suffering is that it actually can be triggered by a whole cascade of entry points. It can be triggered by witnessing, participating in, or directly precipitating situations that produce a wide range of negative moral outcomes. The bottom line is that all of these situations in some way imperil our integrity. So thinking about moral suffering as kind of the umbrella of what we're going to be exploring next, which is moral distress. This is a concept that was first coined back in the 1980s by a philosopher, Andy Jameson, who was attempting to find a way to discuss the kinds of situations that nurses experienced in their roles and the distress that went along with them. His initial definition was about being in situations where one knew what was right to do, but couldn't act on it because of institutional constraints. That definition has continued to be refined, and there are many definitions. Our broader definition is that it occurs when we have violated a core value commitment, where we have failed to fulfill a fundamental moral obligation, or in some ways fallen short under conditions of constraint or duress. And I think what's important about that is that under conditions of constraint or duress. And that's really what Jameson was referring to, that when we are confronted with situations where we actually know what we think is right to do, but we can't act on it, is where that distress really begins to arise. And there are likely internal constraints, but there are also a lot of external constraints that prevent us from doing the right thing. The distress is in response to either threats or challenges or violations of our integrity. So you hear this theme of integrity throughout this. So in my work, and those of many other colleagues around the country and around the world, there are a lot of examples of the kinds of things that cause moral distress in healthcare. And these are just a few of the examples. The idea of causing harm to patients, either because unsafe situations or because of overtreatment and prolonging inevitable deaths with our technology. Providing treatments that actually are not beneficial and may cause a lot of harm to the people that are receiving them. There's often a theme of ineffective communication or lack of continuity among clinicians, where we don't have well-defined goals of care, or there may be instances where patients' choices are being disregarded, or there's lack of complete disclosure about the kinds of options that patients may have in their treatment decision-making that may also, sort of carry over into the area of lack of informed consent. One of the things that causes a lot of distress for clinicians is unsafe or incompetent care, when we see that others may be causing harm to patients. There's also a very prominent theme around intra-professional conflict, where there's an authority differential, where one person has more power than another to make decisions, and others are left to carry them out without sufficient input into that decision-making process. These last two have become much more prominent, and I would argue in the current COVID environment, the inappropriate use of healthcare resources may well be a real source of distress. And to take that even further, the lack of resources that prevents us to do what we normally do in terms of giving people choices and being able to use all of the technology that is generally readily available to benefit the people under our care. And then the last one, providing less than optimal care due to pressures from administrators or insurers to reduce costs. And I would even take that further to say now having to shift our standard of care because of lack of resources is likely causing distress for clinicians. And we're in the process of trying to do some research to understand exactly what some of those sources might be in this COVID-19 environment. What we see pretty universally is a whole series of consequences to these situations that challenge our sense of wholeness and integrity. Some people respond by becoming very angry and morally outraged. They speak out. One of the phrases in our clinical work that you often hear is, why are we doing this? Trying to make sense out of the things that we're doing that we believe actually may be causing harm. Often what happens is people feel powerless. Some people feel voiceless, that their concerns are not being heard. Others may look the other way, become numb, sort of going through the motions. Some will perceive that it's not my role to bring these issues forward and may feel a sense of isolation. Or when they attempt to bring these issues up, there's a perception that their concerns are not listened to or nothing ever changes. And that can lead people feeling defensive or sad, or just sort of complacent by looking the other way. So as you look at these potential consequences, I want you to also think about yourself. How do you respond when you're in a situation where you know what you ought to do, but you can't act on it? What are the consequences for you? And how do you respond? Are there any patterns that you can see? Is there any of these phrases that maybe resonate for you as you think about your own situation? What we do know about moral suffering and moral distress, as an example of moral suffering, is that there's often a moral residue. And that residue can arise from a number of places. One is that we have to make hard choices. And you know, if you think about this COVID-19 experience, we have two competing moral demands: to benefit the person in front of us and also to do as much good as we can for as many people. However we prioritize one or the other of those, there's one that will be unmet. And it doesn't erase the fact that we still have the obligation to benefit people when we prioritize that we ought to help the greatest good for the greatest number or uphold the value of justice. So these unmet obligations can persist even after we've tried to think it through. And what I've learned over the years is a lot of these situations you just can't think your way through. You need more skills than just thinking. But you may choose not the best outcome, but what we sometimes refer to as the least worst outcome. So neither one of them is a good outcome or one that we would choose. But when we sort of evaluate them, there's one that's not quite as bad as the other. And these situations often ignite guilt, shame, regret, or remorse. And in the context of these situations where we experience moral distress, many times the residue comes from being seriously compromised or allowing ourselves to be compromised in these situations. And what's interesting for healthcare professionals, and probably might be true for all of us, is that we're pretty hard on ourselves, and often part of our discernment about have we done the right thing includes whether or not what happened was either avoidable or not. And what's common is that even if it was unavoidable, there weren't any resources, there was nothing else that could be done, we often hold ourselves accountable and responsible for those outcomes. And that accumulation of the weight of those decisions and the residue can be, for many people, almost disabling as they, over time, it accumulates with each situation where they have to make those hard choices. Another response, which we see in no small measure, is moral outrage. And moral outrage is the anger that is provoked by either real or perceived violation of an ethical standard. It is often in response to a feeling of injustice, that either a person or a group of people have been treated in an unjust way. It can often be justified that our response to those violations really needs to reflect that degree of intensity of emotional response. Moral outrage is rarely focused on ourselves. It's most often focused on others. And we could have a whole complex conversation about the contours of moral outrage. But it's a common response. Sometimes it can take the form of a kind of self-righteous indignation, or it can take a more altruistic approach of someone speaking out on behalf of those who cannot speak for themselves. And so it can be a motivator, an initiator of action, or sometimes after discernment and one really evaluates what options are available to respond to these situations, may actually end up in inaction. So with that as a background, I'd like to now invite you to just pause for a moment and bring to your awareness a situation where you have experienced moral distress. Really see if you can just choose one. There may be many, but one that isn't too overwhelming or too emotionally charged, but one that you feel like you might be able to work with a little bit to actually explore for yourself the contours of that situation. And as you recall that, pay attention to notice what happens in your body. Do you notice any areas of tension anywhere? What's your breathing doing? What feelings are associated with this situation? Not to actually judge them or to be self-critical, but just to notice, you know, is there still a charge around this situation? And what's the thought bubble above your head? What are you thinking as you recall this situation? So what I'm going to ask you to do now is I'm going to ask you to do some reflective writing. And this is where you're going to need your pen and paper. And there's actually some neuroscience evidence that suggests the old-fashioned way of pen and paper actually has a different neurologic pathway, a neural pathway in our brain. And so there's something important about actually the physical act of writing. So if you have paper and pen, I would encourage you to use that. If not, use whatever device you'd like to. But I'd like to invite you now to just take several minutes to write in silence about your experience. And I encourage you to write in as much detail as you feel comfortable. Don't want to push anybody too far out of their personal comfort zone. But the mind actually really likes detail. So just write your thoughts. Don't worry about spelling or grammar or structure or anything like that. This is not an assignment. Nobody's going to grade it. But once you begin writing, continue to do so until I ask you to stop. Just let your pen guide you. Try not to overthink it too much. just let whatever needs to be expressed to find its way onto the page. So just finish your sentence and put your last thoughts down on your paper and just finish up. And as you finish up, just to notice what's come up for you as you have written about your experience of moral distress. And as we move into this closing for our session today, I want you to just take a few notes for yourself to notice what happened, what came up for you, what did you learn, any new insights that you might have, questions that have come up in the context of writing about your experience of moral distress. And I'd like to ask you to just jot those down following your description. And when we come together for our in-person discussion, we're going to start first with what you noticed, what your experience was about writing about moral distress, and really to examine the whole experience of what moral distress looks like for you and how it shows up, what the consequences might be, and what we might learn from this. So much of the work that I'm going to be sharing is reflected in our book on moral resilience. This information will be available to you should this information be of interest to you, that you want to do some further exploration. What I'd like to propose now is that we just take a moment to just gather ourselves, and I want to thank you for your engagement so far in this series. And I invite you to actually use this time to explore for yourself what would serve you, and to take advantage of the reflection to explore those experiences in a way that is both beneficial but also compassionate toward ourselves. So thank you very much for your engagement today, and I look forward to seeing you again in person and throughout the rest of this series. Thank you.